If there ever was a perfect storm in a good way for medicine, this is it, because we're desperately needing innovation and cost-saving approaches. It's a consumer-driven revolution. It's using the smartphone as the mediator of this information, where the signal goes, where it's processed to. So it couldn't be better, because this is empowering people to have better tracking of their health and prevention of disease. I've never seen this much high-density innovation across the board with such impactful potential. So this is unprecedented in my view. And it's, of course, coming at the right time, because we need a reset. We need a rebooting of how medicine is practiced in the years ahead. I never thought I would be able to look on a smartphone and see the real-time electrocardiogram. So a lot of things are right in the space that I can appreciate the most, but I've also can see how, for example, why would we have sleep laboratories in hospitals in the future? Who would want to spend night in the hospital trying to sleep and picking up a very common problem of sleep disorders? Why would we have cardiac rehab programs in hospitals when this could all be done in a patient's home or in a local gym? So you start to see how transformative this really is. Just as wireless has changed the way we listen to music, where we read books, communicate to one another, this is what medicine, the chance for digital wireless medical devices to reset the most slow to change, resistant, difficult area in our lives, which is the healthcare system. So this is really quite exciting.
When the inevitable happens and someone in your family gets sick, there is nothing as aggravating as being forced to sit and wait for hours in an emergency room or doctor's office. Then you only see the doctor for a few minutes before you are hustled out the door to deal with insurance and paperwork. Doctor visits are expensive, time-consuming, and frustrating. But what if you and other colleagues at your company could have phone and internet access to a nationwide network of licensed doctors 24/7 and save on health insurance costs? Introducing Call a Doctor Plus, a better way to get the care you need. Imagine being able to call or video conference a real doctor who can diagnose your problem, answer questions, and prescribe medication. No waiting in line or filling out insurance paperwork. Just straightforward answers and solutions for routine illnesses. How does it work? Zach isn't feeling very well, so he decides it is time to find out what's wrong. Instead of making an appointment with a doctor or going to an emergency room, he calls the toll-free number or goes online to set up a phone or video appointment. During the call, the doctor will diagnose his illness, answer his questions, and write any needed prescriptions. Bingo! It's done, and Zach is on the way to feeling well. Call a Doctor Plus is not health insurance. Put simply, it is a monthly subscription for routine healthcare services. Not only does it save hours of time and frustration waiting for a doctor in an emergency room or clinic, there is no deductible and no copay, which saves individuals money and businesses lost income due to employees being away from work. With Call a Doctor Plus, the average callback time for the doctor is only 14 minutes. So you now have access to the care you need on your schedule.
Okay, let's go ahead and get started. Again, thank you so much for coming to today's webinar, where we're going to be talking to you about our program, Call a Doctor Plus, what it is, how it works, and most importantly, how it will impact your business. Today's webinar will last about 20 to 25 minutes, so we'll go ahead and go through this as quickly as possible to make sure that we're making as best use of your time as we can. If you have any questions, feel free to use the GoToWebinar control panel right-hand side of your screen to ask any and all questions, and we'll get to those at the end. Or if you want to, after this webinar, you can follow up with whomever invited you. Feel free to ask them any questions, talk to them about next steps, because chances are if you're here, it's because someone who represents our company and our program has kind of invited you, and so you feel free to go back to them to ask any questions and talk about next steps. So with that said, let's go ahead and get started. So if you're like most of the businesses that we work with, you're facing many challenges as you kind of run through the day-to-day of your business, specifically when it comes to your benefits package and your employees and driving morale and productivity and all those different things. And so we know that when you're looking at your benefits package, most of you are ultimately at the end of the day looking for ways to deliver the best value program and spend a reasonable amount to do it. So the best value for minimal cost. Now, this whole thing has been made a little bit challenging over the last couple of years and even a couple of decades because, forever, as long as we can remember, the cost of healthcare has been constantly rising. And so that's constantly a challenge year after year is how do you adjust for those rates while also being faced with some, recent legislation like the Affordable Care Act and other things that are also making it a little bit more challenging to really kind of keep those costs in line while delivering an excellent benefits package that you want to provide to your employees. So that's become a little challenging as of late. Other challenges that you face is ultimately with your employees trying to drive productivity and overall employee output while also simultaneously attracting and keeping the very best talent. So you want to find good people, you want to get them, you want to keep them with you, you want to keep them healthy, keep them productive, keep them contributing. And so, of course, your benefits package really needs to be something that can allow those folks to be at work, healthy, happy, and really focused on what they're doing in order to really get the most out of them, get the most productivity out of them. And then finally, you kind of put those components together with the idea that your HR team, chances are they're overwhelmed with leaving them very little time to evaluate, much less implement a new concept like telemedicine and what it can do. And we believe that across these lines, across the board, our program can help, whether that's driving down costs or increasing productivity or making it easy on your HR team to implement something like this. We believe that we can help you with all of these challenges and more. So with that said, welcome to Call a Doctor Plus. It's a program designed specifically to help you as an employer save money and drive productivity by utilizing technology to provide your employees with efficient, immediate access to healthcare solutions and other personal services, okay? So what exactly does that mean? How does that work? Obviously, that's a nice fancy sentence, a little bit of a run-on sentence, but we'll talk to you about exactly how that works here in the next 10, 15 minutes. So when you think about our program, the thing I want to put into your head is think about this as a new paradigm or a paradigm shift within the healthcare space. Traditional healthcare has asked you to call, make an appointment, take time off work, drive down to a doctor's office, see a doctor in person, wait for your prescriptions, go, all these different things. It just takes a lot of time and effort, and is not available to you 24/7. It's available kind of 9 to 5, Monday through Friday, and if you don't get those times, you have to go to the emergency room or urgent care, whatever that might be. And that's kind of the traditional model. The new way of doing it, the way that our program allows you to do it, is really to connect with a doctor 24/7, 365 in minutes, rather than days, weeks, or even months sometimes, right? You can connect in minutes. This on-demand access comes via phone, computer, or mobile phone application. And really, a lot of this is predicated on the idea that, according to the American Medical Association, 78% of office visits can be handled via phone. Okay, so this is we'll talk about exactly what this means in a little bit, but these are kind of your common soft issues that most people experience, upper respiratory infections, urinary tract infections, cold, flu, all those different things, right? Those things can be handled very safely, very effectively over the phone instead of actually having to go see someone in person, okay? Our program includes no copays, deductibles, or per-use charges to the employee, which means they can use it as much as they need to, and they can pick up that phone and they don't have to worry about paying. And now this actually makes sense not only for them, because obviously they don't have to pay for that interaction, but it makes sense for you to provide this kind of a plan because each call is going to save anywhere between $325 and $717 in traditional healthcare. We'll unpack exactly what those numbers are, how we get to those, and what it means to you a little bit later. The program is high quality. We very quick response time, on average 14 minutes, and 91% resolution rate, which means 9 out of 10 times you call, you get the answer you needed right there on that first call without the need for a follow-up. You just get the care you need right then and there. Plus, our program includes other health professionals and services. We'll explain what those are and kind of method to the madness there. And this program covers your employees and their families. So it's not just for your primary employees, it's for all of their dependents as well. So it's a very comprehensive program. Okay, so now that we've kind of overviewed the program, I want to spend a little time talking to you about how it works. So it's actually a very simple process. It really kind of parallels the in-office experience, except everything is done online or by phone, making it much more convenient. So step one is to complete your medical history. This is almost the exact same thing as if you were to go into a doctor's office and they give you that white clipboard that everybody knows, right? You fill out your height, your weight, you drink, do you smoke, what's your family history, what's your allergies, are you taking any medications, all those standard questions that you get asked, except this time you're doing it by phone or online. Once that's done, you've completed your medical history, you move to step two, which is to request the consultation. Now, this can be done one of three ways. You can go online, you can use the mobile app, or you can call a toll-free number. Okay, when you request your consult, you're going to provide things like what state are you located in? Do you want to add any images? Do you want to talk to a doctor right now, or do you want to schedule an appointment? You answer a series of questions so that we understand who you are, where you're located, how you want us to contact you. And then once you're done requesting that consultation, again, in about less than 14 minutes on average, you're going to move to step three, which is to talk to a physician. That physician is going to call you back at the number you've provided at the time you've requested, and you're going to speak with that physician just like you would in person. They're going to ask you a series of questions. They're going to try to diagnose and really get to the root issue of what's going on. And once they believe that they have an understanding of the issue, they're going to move to step four, which is to resolve that issue. Now, whether this is an answer to the question, a treatment plan, a prescription, they're going to do what they believe is best for you to get the help you need. In very few circumstances, this might even be like a referral saying, hey, it sounds like you might have a certain chronic condition. Maybe you should go see a specialist. But again, 91% of the time, this issue is resolved right on the first call. Okay, then you move to step five, which is continuity of care. This is all actually happening on the back end. So back in step two, if you as a customer, back when you're requesting your consultation, we'll ask you, do you want us to share a record of this consultation with your primary care physician? If you say yes, then we will, and we'll send a record of that to your primary care physician so that way they have a better overall snapshot of your health. Now, it's important to know at this point, our goal is not to replace a primary care physician or even compete with them. Our goal is to complement and supplement them, right? We're trying to take care of all of the issues that drown doctors' offices that really don't need that kind of interaction, So if it's a basic, reoccurring condition or a prescription refill or something that's very common, or it's something where it's late at night and your only option is the emergency room or whatever that is. Those are the areas where we're trying to come in. But we believe you should have a relationship with a primary care physician. You should be seeing them at least once a year for your physical, if not more often if you have some more chronic conditions. But for all the times when you don't necessarily need to see your primary care physician, if something more routine or whatever that is, that's where our program really comes in and is a much better alternative to urgent care and emergency rooms, which can be very expensive and very inconvenient. Okay. Step six is follow-up. So once everything's done, we're going to send you a follow-up email asking you how everything went, giving you an opportunity to rate us. We really value that feedback. We want to make sure that we're delivering a good service, and this is a primary mechanism for us to make sure that we're doing a good job by our customers. Okay. The common use for our program, now that you know how it works, the common uses are for what I consider and what I kind of call the 80-20 rule applied to medicine, right? 20% of the illnesses that cause 80% of the reasons people go to the doctor's office. That's what we're trying to deal with. We're not trying to be all things to all people. We don't deal with chronic conditions or emergencies, obviously. But, if it's kind of those standard things you get from time to time, and if you look at this list of top 10 on the left-hand side of the screen, if you're anything like I think the average American, you can look at these and say, yep, that's basically the last 5 or 6 times I've gone. Most of them are on this list, right? And so we're trying to take care of those standard common conditions. And on the right-hand side, you can see our prescription management. Everything is done to ensure what I really want to focus on, which is appropriate use, right? So everything's done electronically. All of our prescribing is electronically or by phone, meaning that everything is safe and accurate and very appropriate. The frequency of prescribing when you talk to one of our physicians is actually lower than if you compare us against best provider practice. It's about 80% versus 83%. So a lot of people think that with a program like this, you must really receive, you must really get prescriptions more frequently because of the fact that they can't see you in person. And so because of that anonymity, they must just prescribe first and ask questions later. It's actually not the case. We actually train our doctors to be very specific, very intentional, very appropriate with what they prescribe, making sure that they're going to prescribe only if they feel it's absolutely necessary. And because of that, our prescription rate is actually lower, which is a good thing. We limit antibiotic use to short durations. We don't prescribe anything DEA controlled, no psychiatric illnesses medication, or no lifestyle drugs. Again, this is all about appropriate use. We want to make sure that we're not overprescribing. We want to make sure that we're not prescribing meds that should be having kind of that in-person relationship to make sure it's getting managed correctly. We want to make sure that what we're doing is appropriate to what is needed for our kind of a program. Again, knowing that we're not trying to be all things to all people, but we are trying to take care of a lion's share of reasons why people go to the doctor's office through a program that's much more simple and cost-effective. Okay, and then generic drugs are automatically recommended. Of course, generic drugs are just as effective and a lot more cost-effective. So we like to promote and use generic drugs whenever possible. Okay. Finally, we know how it works and what we use it for. The last question people usually have is, okay, well, who are the doctors that I'm speaking with? It's a very good question. It's a very important question because when it comes to our program, we truly have the highest level of clinical quality and care in the industry because we directly manage our own network of physicians. So all the physicians that we are going to come across with through our program are board certified. They're all state licensed. They have on average 15 years of experience. They're all living and working in the United States. So we're not talking about doctors from other countries or fresh medical school grads here. We're talking about doctors living and working in the United States with a substantial amount of experience, right? All of our doctors are primary source verified, and all of our processes for credentialing and recredentialing have been certified by the National Committee of Quality Assurance. All of these things really speak again to that quality of the experience that you're going to have, because when you're looking at telemedicine, the technology is very similar from provider to provider, but the network is really what makes it go. At the end of the day, it really is something as simple as making and receiving a phone call. But if the person on the other line of that call is not high quality, then your experience is not going to be as good as it can be. Right? And so we really focus on making sure that our physicians are absolutely the best they can possibly be, because we know that their phone side manner is going to directly affect your experience with our program. Okay. Now, in addition to the telemedicine services and the doctor side, we have additional services available as well. Really, the primary driver behind this slide is the fact that we know that anywhere between 70 and 90% of doctor's office visits actually originate with stress and anxiety or mental related factors, right? So what does that mean? So, last time, think about it, when you were stressed or you were anxious about something, you probably weren't eating well, you probably weren't sleeping well, you weren't taking care of your body like you should. And so when that sickness came around, you were susceptible to it. Right? And so, that's why we have these services here, because when we're treating the symptoms, that's really what the medicine is. So when you get sick, we want you to be able to connect to a doctor quickly, efficiently, but that's really treating the symptoms. These things are treating the cause. They're dealing with the root issue, which is stress and anxiety. So telephonic counselors, these are licensed clinical social workers available 24/7, basically to help you through any of life's challenges. We have a medical bill saver program. This is medical or dental bills, anything over $400. They'll come in and work on your behalf. Basically, they keep 25% of whatever they save you. So if they save you nothing, you pay nothing. If they save you $1,000, you keep $750. They keep $250. Okay. We have a discount card. We have legal and financial advisors that are available. Child care and elder care services and suggestions. This isn't actually like daycare centers, but it is if you wanted to find out about daycare centers local to you, or you wanted to find out about senior facilities who are close by, and how does Medicare work and all those different things. You can do that through our child care and elder care services. We also have a host of online work-life resources, from legal documents to issues from adoption to college planning. So many different things are available with just a click away. So you can access all of those online as well. Okay, again, all of this really aimed at helping you live a balanced life so you can be resilient to illness when it comes around and not get sick, hopefully, in the first place. Okay. So when would you use our program? Obviously, there's a lot of times when you could use it. I'm not going to go through all these bullet points, but think about the access side of things. If you're, if you can't get a timely appointment, or you're on vacation or you're away on work or it's 2 o'clock in the morning, when access to your primary care physician is challenging for any reason, instead of going to urgent care or emergency room, heaven forbid, use our program. That's really what it's there for. As an employer, that is really the nice thing about this program is if you have a lot of emergency room visits that are not being used for actual emergency issues, then you're wasting a lot of money on your plan and what you're doing for your employees. And so, we know that around 66% of people who go to the emergency room are not going for emergency reasons. And so that's a lot of people who are inaccurately using something like an emergency room when they could be using something else like our program, really, because they're going in there because it's 2 o'clock in the morning and they have an upper respiratory infection, not because it's actually they broke their arm or anything like that. Okay, and so those are those perfect examples of why our program really exists and what we're trying to do. Okay, so now we've kind of talked to you about our program. Now we want to talk to you about what our program can do for you, and specifically what we do to help you as an employer not only drive that productivity, but also reduce your healthcare costs and various things. Okay, so one of the first things we do with our program that helps with program use is we use a no copay plan. We talked about that earlier. There's no copays or deductibles or per call charges when your employees use the program, and we do that because we know that the lower the copay, the higher the program use. And our goal as a company, as we work together, is going to be to drive and increase program use within your organization. We want people to know what the program is, we want them to know how it works, and we want them to use it. Because when they use it, that is when you as an employer save money. That is when you see those increases in productivity, and that's when your employees benefit from the program the most as well. So the plan design is the first thing we do to help kind of move that needle on program use. And by removing that copay, we really increase the amount of people who are going to actually use the program and how often they use it. The other thing that we do is really focus on marketing and awareness. We're going to work together with you to educate and motivate your employees. There are a host of different ways that we do this, but at the end of the day, our goal is to drive awareness, to increase adoption, to get people to activate their account, and then to get people to use the program. And so we have a multi-phased approach for this. We have a ton of resources, strategies, best practices that are available for you. And this is something, again, this is where we kind of differentiate ourselves from our competition, because most people are out there just trying to sell in telemedicine. We're not just trying to sell it in, we're trying to make sure that people are using it. Because we know how important that is, because successful promotion is what's going to get people to use this program, which is what's going to lead to the cost savings for you as an employer, which really, for most people we talk to, is their number one motivator. Okay, so here's an example. It shows you the impact of communication. You can see this group was kind of cruising along that 20 to 25% utilization range, and they started to get really aggressive with how they were talking to their employees, and you can see that spike. This is over about a 3-year period, but you can see that last 6 to 8 months, how this is really starting to take off, and they're really starting to see a substantial amount of utilization on the program. So it's so important, not that you just bring on this program, but you effectively communicate it to your employees so they know what it is, how it works, how to use it, and they're reminded to use it. So eventually we can retrain them to have this be part of their medical toolkit, right? Their health toolkit, if you will. Okay, and then the final thing we want to talk to you about is the cost savings that you can see as an employer. We know that there are a ton of benefits that come from our program. I mean, just a bunch, from boosting morale to productivity to healthier employees, less sickness being spread around the office. So many different benefits about our program. But the number one benefit that really gets employers excited is the cost savings that our program can provide. Okay, and so the next couple slides we want to talk to you about that number. If you recall earlier in the presentation when I was kind of giving an overview of the program and what it was, I said that you're going to save anywhere between $325 and $717 per office visit. The next two slides are going to help you understand how we get to those numbers. Okay, so this slide is the low side of the spectrum, right? And so when people come in and they ask, and they request a consultation, we ask them, where would you have gone had you not used our program? These are the answers to their questions on the left-hand side. On the right-hand side, we know how much, based on national claims data that we have access to, we know how much each of these visits would cost on average. Add them all together, and you get an average medical savings per consult of $240 roughly. Add in 4 hours of lost productivity at an average wage, according to the Department of Labor, of $21.74. That's another $87 roughly, for a total of around $325.32. Every time someone uses the program, that's how much money is saved. Now, the question becomes not, is that money saved or not? The question becomes, who saves that money when the program's used? And we will get to that in just one moment. But before we do, here's how we get to the 712. There's some third-party validation studies out there that we have. We have a case study on Rent-A-Center. It shows substantial savings for them in the first 2 years, even more significant savings in year 3. This was a very a good example of a company that really dived in, embraced the program, and really kind of forced people almost to know about it and to at least participate in the program, to the point of them getting all their accounts activated and their medical history completed. And you can see what happened as a result. It was a substantial, very, very good program. We have a RAND study out that studied over 300,000 of our patients. The question was, not only, we know that if someone uses our program that they save money, but if a use of our program only results in an office visit anyways, then we're not saving any of that money. And so we wanted to substantiate that. And so what we found is not only is our program more cost effective on the front end, but it's actually more cost effective in the long haul too, because only 6% of our visits require a return visit versus 13% for office visits and 20% for ER. So not only are we less expensive up front, but we're less expensive because there are less return visits that have to happen as a result from an interaction with one of our physicians, okay? And so along those lines, Harvard came along and they did a study on our program, and they studied the impact of spending on 7 and 30-day timelines. And this is suggesting that about 25% of the visits are actually offsetting emergency room visits rather than the 8 that we showed you on the previous page. And it's also they're suggesting that the savings per consult is actually around $712 versus $325. Now, I think that might be a little on the high side, which is why I kind of present both numbers, because the reality is it's somewhere between 325 to 712. It's really kind of somewhere in between there. But you can know there is a substantial amount of money to be saved when people use our program. Okay. So with that said, again, I asked you the question a couple minutes ago of who saves that money, and that's kind of what we're going to go through here on this last slide. We really want to help you make the case for how this program is going to help you not only save money, but why it's going to be a benefit to you. And so if you look at that first bullet, every time our program is used, there's an economic benefit to the employer. This is why we're so focused on utilization and program use and getting that to be as high as possible, because we know the more people use it, the more you're going to benefit as an organization in terms of cost savings, productivity, and a host of other benefits. Okay. The less traditional insurance used, the greater the savings for the employer. This is especially true for people who are self-funded. It's not as true for people who are fully insured in the sense that if you're fully insured, your insurance provider is going to be saving a lot of that $325. You're not going to be saving as much. Now, sure, you'll see it at the end of the year when you come up for renewal and you look at your premiums and your uses and everything, your overall usage and your experience and all that stuff. You'll definitely see a benefit from the program, but it's not as substantial as if you're, say, self-funded. If you're self-funded, every time someone doesn't go to an emergency room or urgent care, you're saving that money. And so all of that $325 basically is going in your pocket. Now, so if you're self-funded, that should be enough. I mean, you should be like, yep, that absolutely makes a ton of sense. That ROI makes a lot of sense. I'm going to go ahead and move forward. If you're fully insured, you might be kind of still like, well, you kind of just told me I'm not saving any money. We'll talk to you a little bit more in one second. Overall, this is going to improve employee productivity due to less time off needed. This is for everybody, no matter what kind of plan design you have. If your employees have faster access to care, we like to say earlier access leads to better results, right? And so people getting access to the care they need sooner is going to shorten the duration of that illness. It's going to allow them to get back to work faster, and it's going to improve your overall productivity. Not even to say just having employees no longer having to take time off work to go down to the doctor's office and all those different things. You're just going to see so much of an improvement with productivity because of this program. On the right-hand side of your screen, now we're starting to talk to you fully insured folks, right? There's 2 different ways, if you're fully insured, for you to use this program and help you drive cost savings and really help justify the spend of the program. The first is a carrier credit. you can go back to your insurance provider and basically use this as a point of negotiation to reduce your premiums. We're seeing people be successful in the area of 1 to 3% reduction in premiums as a result of having our program. If you're paying $8 per member per month and your average insurance is $400 and you save 2%, you've just literally paid for the program right there in those savings. Everything else is just upside in terms of productivity and all these other benefits. Okay. It also provides you with maximum plan design to either raise copay and or deductible and then offset that with our program. So we have companies moving to high deductible plans who are using our program as kind of a stopgap. So you move to the high deductible plan for the emergency or the major life event, and you have our program for the kind of day-to-day illnesses, right, and the sicknesses that come along. Really, it kind of makes a kind of a best of both worlds kind of scenario, right? So that it provides you with that ability to do those things. It's going to lower employees' out-of-pocket expenses, which is in turn is going to drive goodwill. Overall, it's going to be an enhancement to your benefits package. We believe that this program is a win-win for employers and employees, and it's the first one that's come along in quite some time. We're not asking you to skinny down your plans. We're not asking you to shift the way you do things. We're actually asking you to consider a better way to provide health care and quality care to your employees in a way that not only is beneficial for them, but is also beneficial for you because it helps drive down those costs. So with that said, here's a quick little slide that has some companies on there that use us. Just so you know, this is not a new thing. It's not unproven. It's a very proven model. We have over 12 million members, and it's very, very effective. And then, so at this point, I want to say thank you. Hopefully this has made sense to you and really made it kind of come home in terms of how it works and how it can benefit you. The most important thing I want to leave you with is it is not a matter of if you are going to pull the trigger on telemedicine. It's a matter of when. Whether it's today after this presentation and I've motivated you to get started now, or it's a year from now or 2 years from now, the bottom line is telemedicine is a new reality within health insurance. It is here to stay. And the sooner that you can embrace it and use it as a kit within your overall toolkit, a tool within your overall toolkit, the better off you're going to be because it really provides you with some dynamic ways to provide very valuable services to your employees at a very, very fraction of the cost in terms of healthcare expenses. So it's really a great program. I strongly consider that you jump on board. With that said, I'm going to see if there are any questions. If not, feel free to enjoy your day. So it doesn't look like there are any questions, which means hopefully I answered all of your questions sufficiently. If you do have any questions, again, go back to that person who invited you to this webinar. Talk to them about any questions that you have about what happens next, how do you get enrolled. We would love to serve you. We would love to help you. Come alongside you and help educate and motivate your employees and really get this thing burning within your company. So again, thank you so much for coming today. Have an absolutely fantastic day, and we look forward to working with you. Thank you.